Hernia is a sac formed by the lining of the abdominal cavity, peritoneum. The sac passes through a hole or weak area in the strong layer of the abdominal wall surrounding the muscle, called fascia. There are different types of hernias: inguinal hernia, umbilical hernia, epigastric hernia, hernia femoral. Symptoms include nausea, vomiting or both, fever, sudden pain that intensifies rapidly, a lump of the hernia that turns red, violet or dark, inability to evacuate the intestine or remove gas. Risk factors include male sex, advanced age increases hospitalization time, obesity, hernia family history, chronic cough, chronic constipation and pregnancy. To diagnose your condition, your doctor will first perform a physical examination. Your doctor will also likely use imaging tests to aid in their diagnosis. These can include things like abdominal ultrasound, CT scan, MRI scan. We find different types of surgeries, although surgical options depend on individual circumstances, including the location of the hernia. There are two main types of surgery. Open surgical repair closes the hernia with sutures, meshes, or both, and the surgical wound on the skin is closed with sutures. Or laparoscopic repair is used in repeated operations to avoid previous scars and is less likely to cause complications such as infection. Surgical repair of a hernia guided by a laparoscope allows the use of smaller incisions, which means a faster recovery of the operation. Herniorrhaphy is the oldest type of hernia surgery and is still being used. It involves a surgeon making a long incision directly over the hernia, then using surgical tools to open the cut enough to access it. Tissues or a displaced organ are then returned to their original location, and the hernia sac is here. Instead of stitching the muscle opening shut, the surgeon covers it with a flat, sterile mesh, usually made of flexible plastics, such as polypropylene, or animal tissue. The surgeon makes small cuts around the hole in the shape of the mesh and then stitches the patch into the healthy,